Hi everyone, welcome to Parissis Medical. I'm Dr. Parissis. I work in London, UK, in partnership with Feller and Bloxham Medical in Great Neck, New York. What I'd like to do today is tell you that the safe donor area is not where you think it is. When patients or anyone really thinks about the safe donor area, we think about it being like this. Most people know that the basis of a hair transplant is to take hair from the back and sides of the hair where we don't lose them and place them in the top of the scalp. What people generally don't realize is that the safe donor area is not that big expansive area that the red line really covers. It is for some patients, but it isn't for others, and that's what I'd like to discuss. Now, I want to begin this discussion by talking about two specific patient examples. I want to talk to you about this patient. This is a patient who came to us in his early 40s, and as you can see, he'd experienced some mild frontal recession. I say mild because he hadn't lost much hair. This patient's crown was very much preserved and he hadn't experienced any diffuse hair loss. It was simply the kind of frontal temporal regions that had receded slightly. But as a man in his 40s, I would not describe this as a patient who has lost a significant amount of hair. So you can see here what I'm doing is I'm considering his age and the amount of hair loss that he's experienced. And with those two pieces of information, we can work out the sort of rate of his hair loss. And we can say that with this particular patient, it is not particularly fast. It's somewhat slow. Now, with this patient, we would be more than happy accepting that the patient's safe donor area would somewhat resemble this. So as you can see, the grafts that would be safe for us to take for this patient are likely to extend all the way around the front, all the way around the back, up to the top, to the crown, down to the bottom of the lower hairline, and round to the other side as well. So we'd be very happy to take grafts from there and put them onto the top of the scalp and to fix his frontal recession, which is what we did. However, I want you to consider a second patient. This patient is in his 20s and he has experienced a significant amount of loss in the crown. You can see it really is quite blown out. Generally speaking, when we see a patient under the age of 30 who's experienced a good amount of loss in the crown, this is a patient we can quite comfortably say is experiencing advanced hair loss. That's a very fast, that's a very rapid rate of hair loss. This patient is likely to reach that Norwood 5 to 7 that we see in about 16% of the population. It's surprising to hear that 16% of the population reach a Norwood 7. That's about 1 in 6 men walking around. 1 in 6 men resemble this gentleman here. Without intervention, this patient is very likely to end up looking like a Norwood 7 patient. So my proposal is that the grafts that we can take from the safe donor area of our patient 1 are not the grafts that we can take from the safe donor area for our patient 2. And the reason for that is because in patients with advanced hair loss, the safe donor area is actually much smaller and can contract to make a much smaller safe donor area that resembles this. What I want you to pay attention to is the blue shaded area. This is the area that is most safe for every single patient. Now, whilst most patients who even reach a Norwood 7 are likely to retain more hair in and around this area in blue, there's a possibility that they can fall out too. Patients can experience what we call retrograde alopecia, which is essentially it's a recession of the posterior hairline. So that means the hairline at the back at the neck. This hairline can actually recede, just like the hairline can at the front of the head. Those grafts and those hairs back there are sensitive to DHT. Also, the hair just above that safest donor area can also be lost. It's very difficult to predict how far down a crown may dip. Some patients' crowns can be relatively maintained and they can be what we call high crowns. Other crowns can be quite low. And so it's very difficult to predict either side of that safest donor area. It's very, very difficult to say just how much of that hair will be maintained later in life. But what we can be sure of is that region in the blue. We can be almost 100% confident that in every single man, that area is going to be maintained for the rest of that man's life. And so this is something that patient 2 should consider when he's thinking about which approach to take in hair transplant surgery. So if patient 2 wants to intervene and do something about his hair loss, it makes sense for him to try and take as many of those grafts in the safest donor area as possible. I think no one would disagree with that. Of course, he could be one of the lucky patients who reaches a Norwood 7 and still has most of the safe donor area, but still, no one wants to take a risk with this kind of thing. So what I'm trying to emphasize is that the only way to take 100% of the grafts in the safest donor area is to do the FUT technique. With FUT, we can take all of the grafts within that blue region. One could argue that you could do the same with FUE. However, with FUT, what we do is not only do we take the grafts, but we take the skin with it. And in taking the skin with it and closing it up afterwards, we actually reduce the surface area of that. That means that, we leave behind a nice pencil-thin scar and not actual bald scalp that we would do if we were taking them with FUE. If you imagine us taking all of that safest donor area with FUE, that area of the scalp would be completely bald, and that would be very difficult to hide. Instead, by doing FUT, you leave behind a beautiful little pencil-thin scar, the average of our scars being less than 2 millimeters, and you take all of those juicy grafts. In conclusion, if you're a patient who resembles patient 2, you're also considering getting FUE at a clinic that is trying to transplant grafts all over the back and sides of your head, there's a possibility that those grafts can fall out and you are missing out on that safest donor area that I encourage you to take advantage of. Because if you're someone like patient 2, unfortunately there is a high possibility that you could become that 16% statistic and possibly lose more down the line. So what I propose is to do FUT first, to take as many of those juicy, most androgen-resistant grafts in the center there, in that blue region, and then you can do FUE down the line. Once we've removed all of that central area, there's no reason why we can't then do some FUE and take some grafts from a little bit outside of that safest donor area and venture into the rest of the safe donor area. It's really important to take as many of those grafts as possible so that you can combat hair loss and have as much hair on the top of your head as possible for the longest time possible. Thank you so much for listening. I think the main points that I'd like to emphasize is that advanced hair loss is actually more common than we think, that the safe donor area is not as large as we think, that central region, or what I call the safest donor area, should really be harvested as much as possible, and that doing FUT first is the best way to do this. Once again, I'm Dr. Parissis from Parissis Medical. I'd like to thank you for listening. I look forward to seeing you in the next one.